Good afternoon, Dr. Frere. Would you like me to get started?
Yes, you have the slides, right?
I do.
Okay, perfect.
Great, wonderful. Good afternoon, everyone. Today is May 4th. Welcome to the Department of Public Health media briefing. I'd like to thank everyone so much for your patience today. We do apologize for the last minute change, and we appreciate your flexibility. Due to the nature of this platform, we ask that everyone remain muted during the presentation. Additionally, we ask that you keep your camera off as well, since Dr. Frere will have her camera on. Once Dr. Frere has completed her presentation, we will take your questions. As usual, please use the hand raise icon to add yourself to the question queue. I will then announce when it is your turn by using your name that you've listed, and then you may unmute yourself to ask your question. Dr. Frere, when you're ready.
Yeah, thanks so much. And I want to sort of echo my appreciation for your flexibility today. I will open, as always, with a status update. I'll review current metrics for our early alert signals and preparedness measures. And I'll discuss some of the actions that high-risk settings, businesses, schools, and residents can take to mitigate the risk of COVID-19 across the county. After that, of course, I'm happy to respond to questions. I could take the first slide. Over the past week, the upward trend in cases has continued, and we're reporting 2,484 new cases today. The average number of daily new cases reported over the last 7 days increased to nearly 2,200. That's a 25% increase in a single week. This week, our 7-day average daily case rate also increased to 21 new cases a day per 100,000 residents. That was at about 17 new cases a day per 100,000 residents a week ago. And the weekly case rate remains elevated at about 136 cases per 100,000 residents, signaling that LA County continues to experience a high rate of transmission. While cases have been steadily increasing, we are relieved that our test positivity rate has only gone up slightly, and that COVID-19 related hospitalizations and deaths have remained relatively stable. The average daily test positivity rate is now slightly over 2%, and we have 248 COVID patients currently hospitalized. Furthermore, as I noted, we do have these relatively low number of deaths. We're reporting about 5 deaths a day for the past week. But because deaths are a lagging indicator, we are a little concerned that we might see an uptick in the upcoming weeks. I do want to extend my deepest sympathies, along with my wishes for strength and peace, to everyone who's grieving the loss of a loved one from COVID-19. Next slide. In addition to reviewing the data from the past week, it's helpful when we look at our key metrics over a longer period of time. On this slide, you can see the trends over the past 4 weeks for our 7-day average daily cases by report date, the 7-day average daily hospitalizations by admission date, and the 7-day average daily deaths by report date. The 7-day average daily cases, that's the green line, have been steadily rising since the end of March and increasing more rapidly since April 20th, resulting in an almost 200% increase over the past month. The 7-day average number of hospital admissions, that's the orange line, as you could see, remains relatively stable. This could reflect that customary lag that we see between cases and hospitalizations, although I'll note that this would be a longer lag period than what we usually see. It also is likely to reflect the protective effects of vaccinations, boosters, and therapeutics. It is important to note that many other communities, however, across the country are beginning to see increases in hospitalizations that are associated with the highly infectious BA.2 and BA.2.12.1 variants that are circulating widely now across many regions in the United States, including here in LA County. Deaths as a lagging indicator, you can see the 7-day average of daily reported deaths with the blue line also stayed very stable over the past week. Today's 7-day daily average of deaths is about 1/3 of the average from about just a month ago. Next slide. Our community level rating, which, as you all know, is a measure. We're going to ask that people just when they come on, please mute. Is a measure of severity of disease and strain on our healthcare system, and it remains, as you could see, at low this week. The first hospital metric that determines our community level is the 7-day cumulative rate of new COVID-19 hospital admissions. The current rate of 2.6 admissions per 100,000 residents meets the CDC criteria for the low community level. And after an initial decline, this rate increased last week to 2.3 admissions per 100,000 residents, and it's continued to increase slightly throughout the whole week. The second hospital indicator is a 7-day average for the proportion of staffed inpatient beds occupied by COVID-19 patients. This has been relatively stable this past month, and today it's at 1.4%, which also indicates low community level. Together, these metrics indicate that COVID-19 is not putting pressure on our healthcare system and resources at this time. Next slide. Our community-wide and sector-specific indicators can provide early alerts that transmission and risk could be increasing. If a metric signals a possible area of elevated concern, we do consider opportunities to implement protective strategies and communicate information to residents and workers about the sensible steps they can take to protect themselves and others. Since March 31st, our measure of the percentage of specimens sequenced that are identified as a new variant or subvariant of concern has remained at high concern. This week, 96% of recent samples in LA County were identified as BA.2, an Omicron subvariant of concern, or one of its sublineages. And I'll discuss that in more detail shortly. 2 additional metrics are also cause for elevated concern. First, with 13 new outbreaks at TK through grade 12 school settings reported in the past 7 days, school outbreaks now are cause for medium concern. We also saw an increase in worksite clusters with 108 cluster reports in the past 7 days. This metric now is also of medium concern. In a little bit in the briefing, I'll outline some of the steps that we're recommending to limit transmission in TK through grade 12 school settings and work sites, as well as other higher risk settings. First, though, I did want to talk in a little bit more detail about several of the early alert signals. So we can go to the next slide. Through our routine sequencing of positive specimens, we continue to identify variants and lineages that may have a significant public health impact. And you can see the latest results on this slide. Of note, whereas in the past, we included BA.2.12.1 sequences in the BA.2 counts. This week, BA.2 and BA.2.12.1 results are presented separately in this chart with slightly different shading of blue. For specimens collected in the week ending April 16th, Omicron accounted for 100% of all the positive cases that were sequenced, with the BA.2 lineage and sublineages accounting for 96% of these positive sequence specimens. Nationally, BA.2 and its descendant lineages remain the predominant strain across the country. For the week ending April 30th, the CDC estimates that BA.2 accounted for 62% of sequenced specimens in the United States. However, there's an increasing circulation of the sublineage strain, BA.2.12.1, which the CDC estimates may be 25% more transmissible than BA.2, which, as many of you remember, is at least 30 to 50% more transmissible than BA.1, BA.1.1. The BA.2 subvariant accounted for the BA.2.12.1 variant accounted for approximately 37% of positive sequence samples in the United States, and that was up from about 29% the prior week. In LA County, for the week ending April 16th, we saw just a small increase in BA.2.12.1, with 8% of positive sequence specimens identified as being that sublineage. Last week, the CDC announced that additional evaluation is underway to understand the impact of BA.2.12.1 on vaccine effectiveness, but at this time, they do believe our vaccines can continue to protect those who are vaccinated, especially if they're boosted from severe illness. Although they're not common in the United States, we're also monitoring two other emerging Omicron lineages, BA.4 and BA.5. In LA County to date, only one positive sequence specimen has been identified as BA.4, and none have been identified as BA.5. However, these lineages may have a growth advantage over BA.2, and they're believed to be contributing to a rapid rise in COVID-19 cases in South Africa. BA.4 and BA.5 also have a mutation that was present in the Delta variant, which may have been related to the increased severity of disease caused by Delta. Thus, while we closely monitor research on these variants and sublineages, residents and workers should take prudent precautions to avoid getting infected and transmitting COVID-19 to others. And those who are higher risk for severe COVID-19 should ask for severe COVID-19 illness, should ask about therapeutics ahead of time so they have a plan for what they're going to do should they become ill with COVID. Next slide. As we've discussed previously, upticks in the concentrations of the SARS-CoV-2 virus in wastewater can also alert us to the possibility that community transmission in a certain area is increasing. While we've been monitoring wastewater concentration for 4 sewer systems across the county, for the next couple of weeks, we're only able to report out on 2 of these systems. The LA County Sanitation District's Joint Water Pollution Control Plant, whose wastewater surveillance covers the southern and eastern parts of the county that are not part of the city of LA. And the second system is the Los Angeles City Sanitation and Environment Agency, whose wastewater surveillance covers most of the city of LA. Data is not going to be available for the LA County Sanitation District's Lancaster Sewer System or the Las Virgenes Municipal Water System for a couple of weeks while these sewer systems transition to a new testing laboratory contractor. This slide shows the latest data from the LA County Sanitation District's Joint Water Pollution Control Plant. The white line represents the 10-day rolling average SARS-CoV-2 wastewater concentration. That blue line in the middle, the dashed line, shows the average SARS-CoV-2 wastewater concentration from 14 days ago. And the yellow dashed line shows what twice the average SARS-CoV-2 wastewater concentration from 14 days ago would be, which is what would signal a cause for concern. As you can see over the latest 7-day reporting period, the average wastewater SARS-CoV-2 concentration remained fairly level, and the last measurement was just below the average from 14 days before. Next slide. This slide shows the data from the LA City Sanitation and Environment Agency. Here again, we see no significant changes to the average wastewater concentration of SARS-CoV-2 over the last 7-day reporting period. Next slide. With increased community transmission that we're seeing with our case numbers, we're also seeing increased transmission at work sites. With the number of worksite cluster reports now surpassing 100 this past week, the indicator for worksite transmission has been elevated to medium concern. Between April 25th and May 2nd, there were 108 clusters reported. 45% of these were in the manufacturing and retail trade sectors. Businesses most frequently represented in this sector included electronics and appliance stores, that's like retail trade, transportation equipment manufacturing, that's under manufacturing for us, and building material and garden equipment and supply dealers, and that's again retail trade. With cases increasing at work sites, additional prevention strategies are strongly recommended for all work sites, regardless of whether there are currently cases at the site. Public health continues to appreciate the many workers and employers that are taking protective measures. And we're working closely. I'm going to just ask that people mute to try to avoid that echo. We're working closely with Public Health Council liaisons to help provide increased outreach, education, and technical assistance to workers who may be in the higher risk industries. Next slide. We're also experiencing an increased number of outbreaks in the TK through grade 12 schools, with more than twice as many open between April 27th and May 3rd as in the prior week. With 13 new classroom outbreaks open, 10 of which were in elementary schools and 3 in middle schools, this has also raised elevated concern. As I'll discuss today, public health is working closely with schools to support measures that can reduce on-campus spread. The outbreak count represented in our early alert signals does not include school-affiliated outbreaks occurring outside of the classroom setting, although we do track those. These are outbreaks associated with youth sports and extracurricular activities, including theater, band, choir, or service clubs. And we've also seen an increase in the number of recent outbreaks in these extracurricular activities. Many of the outbreaks outside of classrooms, some of which have involved dozens and dozens of students, have been linked to activities such as indoor school events, proms, musical and theater performances, and field trips. We do encourage schools, families, and students to adopt measures that reduce the chance for spread at these school-affiliated events. Some of those would include requiring indoor masking if there's going to be large numbers of students and other community folks together, pre- and post-event testing and symptom screening, and improving ventilation both in indoor sites and on transportation. Next slide. In addition to outbreaks, we also track testing volume, test positivity, and the number of cases at schools. This slide shows school testing volume represented by the blue bars and test positivity represented by the purple trend line over time. As you can see, testing volume remains high. There were nearly 460,000 tests conducted between April 25th and April 29th. You can also see that while test positivity rates remain very low since the end of the winter surge, they are creeping up a bit over the past 3 reporting periods, with the current rate now being 0.4% test positivity. As a note, that's much lower than the community transmission rate. Next slide. Similar to previous periods during the pandemic, when there's increased community transmission, we often also see increased cases among staff and students in our elementary, middle, and high schools. And you couple this with the fact that indoor masking requirements at schools were lifted on March 12th. You can see that within a few weeks of that, the number of cases reported among students in youth sports, elementary schools, middle schools, and high schools more than quadrupled between March 27th and April 24th. There are now nearly as many cases among students and staff as there were in mid-February. With students and staff recently returned to campus after gathering and traveling for the spring holidays, and with lots of end-of-the-year events happening, we will continue to see additional increases unless there's a very big difference in the amount of protection that individual people are taking. In a few moments, I'll share some of the preventive measures that we're encouraging our school partners to put in place to amplify protections for students and staff. Next slide. The next 2 slides, as usual, will quickly report out on the latest results for our 13 preparedness measures. This week, all measures once again suggest satisfactory preparedness, aside from the metric that tracks the percentage of positive case specimens that are sequenced each week. Of note, the percentage of eligible homebound residents referred to DPH who received their vaccine within 2 weeks of referral increased this week from 81% to 87%. We're pleased to see that this metric has improved since last week, since we did assign additional staff to support this effort in response to the drop in performance the prior week. Next slide. As we mentioned, we didn't meet, and you can see here, our target of sequencing 5% or more of positive case specimens per week. For the current measurement period of April 10th through the 16th, 3% of positive specimens were sequenced. And that's not really adequate to allow us to best track circulating variants, identify new variants or sublineages, or really understand some of the key characteristics of emerging variants. We noted last week this sequencing has declined significantly when the lab that was performing the majority of sequencing for LA County lost the federal funding that had supported this work. We are reaching out to other labs so that they provide us with their sequenced specimens or their sequencing results. And we're also in the process of establishing a contract with a new laboratory that will be able to conduct additional needed sequencing. But it will take us, in all likelihood, another week or 2 to get the additional reports submitted to us and the contract up. Next slide. Since the onset of the pandemic, we've been working with high-risk settings, including healthcare facilities, long-term care settings such as skilled nursing facilities, emergency shelters, shelters for people experiencing homelessness, correctional and detention facilities, and public transit settings to mitigate the impact of COVID-19. Our multidisciplinary public health teams provide these sites with information, education, and consultation on infection control practices, and we help them implement preventive strategies that are specific to their sites. Indoor masking is required at all these high-risk settings, and we continue to help ensure that there's an adequate supply of well-fitting masks or respirators as required under law or state rules for staff, visitors, patients, and residents in these healthcare settings, long-term care settings, senior care facilities, and at our shelters. And with CDC continuing to ask that everyone 2 years of age and older, regardless of their COVID-19 vaccination status, wear a mask in the indoor corridors of public transit, we're grateful to the county transit partners for educating the public and their employees on this safety measure requirement. Careful adherence to isolation and quarantine rules in these high-risk settings also reduces the chance that COVID will spread to workers, customers, patients, and residents, all of whom may be more vulnerable. Our teams routinely provide information and consultation to help high-risk sites apply rules, including setting specific requirements and exceptions for quarantining and isolating. Effective infection control and outbreak management practices help us and continue to help us prevent spread, along with optimized ventilation. In addition to the universal recommendations, we do encourage healthcare and congregate living settings to improve access to and the utilization of vaccinations, boosters, and therapeutics, and to follow the state and the LA County guidance for routinely screening and appropriately testing staff, patients, or residents who aren't fully vaccinated or had an exposure. And I want to note that we are capable of taking mobile teams to any sites to help them increase coverage around vaccinations, boosters, including second boosters. We do acknowledge that putting new systems and protocols in place is challenging, and we appreciate the commitment that many of these high-risk settings have made to protecting their workers, patients, residents, and customers. Next slide. As I mentioned, the number of outbreaks, the test positivity rate, and student and staff cases all recently increased at TK through grade 12 schools. And this, given that there are high rates of virus transmission in the county, while not unanticipated, it is a cause for elevated concern. And I want to thank all of the school districts, the parents and students that are working hard to implement sensible prevention measures that can help curb transmission among students and staff, whether they're in the classroom or they're participating in school-affiliated activities. We have a specialized public health school support team, and we offer our school partners information, resources, help with outbreak management, and technical assistance that can support strategies specific to a school environment that will enhance safety at schools and at school-sponsored events. Given the higher case numbers at schools, public health continues to strongly recommend that all students and staff wear well-fitting masks or respirators when they're indoors. And we do require masking indoors for any asymptomatic staff and students who have been exposed to someone with COVID-19. This simple step can make a substantial difference, as we know that wearing a face mask or respirator in an indoor public setting has been associated with significantly lower odds of testing positive for COVID-19, and that masking requirements in schools have been associated in the past with a lower risk of outbreaks. We also encourage schools to incorporate response COVID-19 testing into their regular operations. Response testing includes ensuring access to testing for students and staff who have been exposed to a person with COVID-19 and or to people who have COVID-19 symptoms. In addition, we recommend that if resources are available, schools can offer weekly testing for those who are not fully vaccinated, since these individuals remain at elevated risk of becoming severely ill should they get infected, and they would benefit from an earlier diagnosis. With funding from CDC, we've partnered with the LA County Office of Education and Haluna Health to support COVID-19 testing in public, charter, and private schools across the county. We are supporting school-based COVID-19 testing programs, as well as providing testing support on site. This has included the distribution of over 8 million over-the-counter COVID-19 tests provided by our department, the state, and CDC for use by students and staff in schools all across the county. Parents and students are expected to follow the isolation and quarantine health officer order. Students who are required to isolate shouldn't return to school until they've been released from isolation. If they meet the criteria to leave isolation early, they'll need to wear a highly protective mask around others, except when they're eating or drinking, for 10 days after their symptoms started or the date of their first positive test if they're asymptomatic. Exposed asymptomatic students, as I mentioned earlier, can remain in school, provided they wear a mask indoors when they're around others for 10 days after their last exposure, and are tested 3 to 5 days after exposure to make sure they aren't infected. This is a sensible precaution for people who have had a known exposure and do not wish to stay isolated in their homes during the quarantine period. As at other work sites, indoor work sites, given the ability of SARS-CoV-2 virus to be aerosolized, schools are also encouraged to consider ways that they can improve ventilation. That can range from keeping doors and windows open, to installing high-efficiency air cleaners, to ensuring that the HVAC system is in good working condition and filters are changed frequently. We also know that having a highly vaccinated community reduces transmission and hospitalization risks, and we remain committed to helping schools provide easy access to vaccination for students and staff, as well as reliable vaccine information for school staff, students, and parents. There are nearly 700 school-based vaccination clinics that are scheduled for May, offering pediatric doses for 5 to 11-year-olds, as well as vaccines and boosters for eligible individuals 12 and older. To date, there have been nearly 9,300 clinics held at schools throughout the county. Thanks to the strong partnership with so many school districts and parent groups, there are also expanded opportunities for parents and students to enroll in the Parent and Student Ambassador programs. To date, over 1,700 parents and nearly 550 students have completed these training programs, and they're able to educate and inform others in their schools and communities about the COVID prevention strategies. Next slide. With increases in outbreaks at work sites, we're also encouraging employers to put safety measures in place that can protect workers and customers. Many of these measures are the very same practices that are used at high-risk settings in schools, including encouraging indoor masking, requiring symptomatic workers to isolate and test, requiring those workers that have been exposed to COVID-19 to test as soon as possible, as well as wear a well-fitting mask indoors around others, and recommending that work sites optimize ventilation. With increased transmission, employers are reminded that they're required to offer well-fitting masks and respirators to workers who work indoors in close contact with others. While not routinely required, physical distancing in communal areas such as break areas and cafeterias is recommended at work sites while we're in a period of higher transmission. In addition, all employers are required to report 3 or more COVID-19 cases within a 14-day period immediately to the LA County Department of Public Health so that we can investigate and provide guidance and assistance to the work sites to prevent unchecked transmission. As clusters are increasing, we'll continue to promote these safety measures in all work sites and prioritize messaging to the sectors at higher risk: factories, manufacturing plants, places where there's a lot of contact with the public in indoor settings. Next slide. I do know that most everyone is tired of the pandemic, tired of wearing masks, and exhausted trying to deal with the uncertainty and the ever-changing guidance. And it's very tempting to minimize the impact of the virus to support our desire to return to our pre-pandemic lives. Unfortunately, I think that would be a mistake that could make it harder for us to embrace strategies that extend protections while minimizing disruptions. There continue to be sensible steps we can take to reduce risk and prevent serious illness and deaths among those most vulnerable. To protect yourselves and others, please wear a well-fitting, highly protective mask or respirator when you're in close contact with other people indoors. Get vaccinated, and if you're already fully vaccinated, get a booster dose or your second booster dose if it's your time. If you do become ill, please stay home, away from work, school, and public sites. Get tested, lots of places, a testing site, your doctor's office, a pharmacy, test at home. And if you test positive, please notify your close contacts and follow the public health isolation rules. If you have mild to moderate symptoms, tested positive, and you're at risk for severe illness, and as of now, that risk includes that you live in communities that are under-resourced, where there's high levels of poverty and high levels of health-harming exposures, you can ask that your provider, you should be asking your provider about therapeutics. Given the importance of starting these medications within a few days of the onset of symptoms, Public Health is also offering a telehealth option. You never need to leave your house after you test positive. Residents can call 833-540-0473 7 days a week from 8 in the morning till 8:30 at night, be assessed for eligibility over the phone for antiviral medications. And if you're eligible, the medication will be sent overnight to your home or to a nearby pharmacy of your choosing. This service is entirely free. With increasing community transmission, it's possible that you'll be exposed to COVID-19. And if you are, we do ask that you follow the quarantine rules. And if you're asymptomatic and you're eligible to not remain home during your quarantine period, it is because you are getting tested, you're monitoring yourself for symptoms, and you're always wearing a highly protective mask around others, especially indoors, for 10 days following your exposure. And finally, if you're at high risk for COVID-19 or you're living with someone at high risk, given the higher rates of transmission, be strategic about gathering with others. Make sure that you and other guests are vaccinated and boosted as appropriate. Gather outside if it's possible. Keep the gathering relatively small. And if you're going to need to be indoors, improve indoor flow with open windows, doors, and fans. And it's still a good idea to get tested before and after gathering as well, especially if you think you may have had an exposure. In closing, as we continue in this post-surge phase of the pandemic, we do remain focused on preventing serious illness and death, recognizing that high rates of transmission increase the risk of serious illness for those most vulnerable, and also can lead to new mutations that will evade our vaccine protections. Businesses, schools, healthcare facilities, and other organizations continue to play a key role in promoting safety. However, as we've learned from our experience, we have a better chance of preventing tragic outcomes when we slow the spread, and that will most easily happen if we take care to avoid getting infected and infecting others. Thanks to all of the businesses, organizations, and individuals who are doing their part to help us protect each other. This concludes my remarks, and I'm happy to answer questions.
Thank you so much, Dr. Freer. Now we'll begin our question and answer period. I would just like to remind everyone to please remain muted and keep your cameras off. You may use the hand icon to get into the question queue. Our first question is going to come from Lolita Lopez from NBC4. Lolita, you can unmute yourself. Oh, and keep your camera off.
Sorry about that. Thank you so much. Dr. Freer, thank you so much for updating us on everything, for taking my questions. I have a few, if you don't mind humoring me on that. You talk about some of these increased numbers, and it's been characterized as a new wave or a new surge. So would like to know how you're characterizing the increase in COVID cases at this time. In addition, you talked about the early alert signals, and 3 of those now are at an elevated. If as part of your next steps, when does it become more of a requirement in terms of changing your community preventions rather than a recommendation, especially in schools and work sites that are seeing those increases? And lastly, a lot of the time we rely on testing to show us, what is happening in our communities. But testing across the state of California has gone down in terms of people going to test, many people doing that at home. How can you feel confident that we know what's actually going on in terms of positivity rates in our communities? Thank you.
Yeah, thanks so much. Those are great questions and really appreciate them. I'm going to start with the last about, what's the tension with lots of people testing at home and our ability to really track transmission in our communities. So, I first of all, I want to thank people who are testing at home. I think it's great that we're able to test at home. I rely on it heavily, as does everybody else who's working here. So we appreciate also that for most of us, if we have health insurance, our health plans are required to pay for those testing kits, making it easier for us to actually do that testing at home. And we spent a lot of time trying to communicate with folks what to do when they get a positive test. So, we've really shifted sort of our communication strategy to recognize that since many of those cases are not going to be reported to the public health department, we're not necessarily going to call you up and, try to help you figure out how to isolate and identify your close contacts. We've been trying much harder to just get general information out so that folks who are testing at home, test positive, know what they're supposed to do when they do test positive. I think the second issue you raised, though, is equally important, is are we losing our ability to actually understand how much transmission there is? And I want to say it's always been problematic. Remember at the very beginning, we didn't have enough testing capacity. We've also had problems with labs not reporting to us test results in a timely way. So testing has always been fraught with difficulty in terms of our ability to use those numbers with 100% certainty that we know exactly the level of transmission that's happening. That being said, it's still a good predictor, and we've coupled it now with the wastewater surveillance as well. So, we should, since we have a lot of the county covered with the wastewater surveillance systems, we should be able to see to see with a fair amount of certainty when in fact we're seeing particularly those explosions in cases, because the concentration of the virus in wastewater should be going up as well. So with us seeing the small rise, and that'll transition to your first question, with us seeing the small rise in cases and seeing also over time, we've seen a small rise in wastewater concentration. We feel that we've got a pretty good sense of the fact that there is a lot of transmission going on in the county, but we're not at the alarming rates we were during the height of the Omicron surge. And I would not call what we're seeing right now a surge. It's definitely an increase in cases. We most worried during Omicron because wish I had that slide, but we had a super steep increase. Like it was like a line that went straight up. Like we went from having a relatively small number of cases to having 45,000 cases in a very short time period. What we've been seeing now is this gradual increase, which is more tolerable. It allows us to, particularly in high-risk settings, get in front of some of the transmission and introduce some measures that actually can help, we hope, slow down the spread. It also allows individual people to make different decisions as they see this trajectory of increased cases. The unknown, and the reason there's always caution for us is the unknown is what happens as we continue to see more transmissible variants cropping up and really dominating what then circulates. So if BA.12, BA.2.12.1 ends up dominating here in LA County, and it is 20 to 30% more transmissible than BA.2, which was already a lot more transmissible than BA.1, we will continue to see these increases in cases unless people are being more careful than they are at the moment. More transmissible means we all have to live with that reality that those exposures will happen more often. That's what more transmissible means. There'll be more people that'll be infected. More of those that are infected are likely to spread more quickly to other people. So we're all going to need to adapt. how we're handling that increased risk to avoid sending us into that steep increase that we all desperately want to avoid. And then in terms of, the early alert signals and how are we thinking of that in relationship to moving to requirements, I do want to say for the sector specific signals, we have 4 of them. The outbreaks, we're tracking the outbreaks at skilled nursing facilities, at shelters, at schools, and the clusters of cases at work sites. And there's already guidance out there that when we get to medium concern, what we ask those sectors to do, and when we get to a high concern, of what we ask those sectors to do. A lot of it is sort of our sensible recommendations, but there are some requirements embedded in there. They're few, and we don't ever just sort of insist that an entire sector move very quickly to make a change. We weigh that with all of the other information we have, including how good we're doing on making sure people can access therapeutics. Because the one new tool that we have that's very powerful is that even people who test positive now, if we can get them their therapeutics in sort of that short time frame, there's a very good likelihood that we can prevent them from going on and experiencing that severe illness that we all want to avoid. So we're anxious to sort of keep tracking, but also constantly look at our other response capabilities to decide what makes most sense. At this point in time, we think with all of us taking sort of additional care, keeping our masks on more often than we might have a couple of weeks ago when our cases weren't increasing at this rate and we didn't have this much transmission, we think that will make a difference. We also want to constantly encourage everyone to go get vaccinated and boosted because that data on the protections you get from that against severe illness have held up now through 5 different variants. Pretty powerful protection with those vaccines and boosters against the worst outcomes for them. Thanks for those questions, and I'll take the next question.
Our next question comes from Ron Lin from the LA Times. Ron, you should be able to unmute yourself.
Hi, Dr. Furr. Thanks so much for talking with us. Really appreciate it. Questions today are on reinfection, airports, relapse of COVID following Paxlovid, and a crystal ball question. So first, on reinfection, I think you've mentioned before that BA2 is unlikely to reinfect people who survived BA1, but what do we know about BA2.12.1? Can that reinfect survivors of BA1? On airports, we're hearing from a couple of people that masking compliance has been poor at LAX and Long Beach. What are you hearing, and is anyone asking people to mask up there? On COVID relapse, there was a blog post in the New England Journal of Medicine that said that there are reports of coronavirus positive people who take Paxlovid suffering a relapse in COVID once they finish their treatment. After their symptoms resolve, they start testing negative, but then they get their symptoms again and they start testing positive. What happens if this happens? Are these people contagious, and should they restart the isolation period all over again? And then finally, a crystal ball question. We've in just the last couple of weeks, we've seen hospitalizations go up, and now they're stable. Your counterparts in the New York City and the Bay Area have had varying reactions. New York has raised its COVID level, but San Francisco doesn't seem particularly concerned. They just feel their hospitals are doing well. And the CDC today forecasted that they expect weekly deaths to rise for the first time in a while. What are the range of possibilities you're preparing for this spring and the summer? Thanks.
Thanks, Ron. Let me go to the last question because I didn't get it all. I didn't get to write it all down, so I don't want to forget it. The crystal ball questions are hard, but I think you sort of maybe answered it for us at the end. Is it's in preparedness right now. Like I don't think anybody really can answer definitively any of the questions you asked. Like, do we know for sure what's going to happen with hospitalizations? Do we know for sure what the impact is going to be, particularly on now the newer subvariants, BA.2.12.1. We got BA.4 and BA.5 in South Africa, all that are significantly mutated from what we've seen. And every single time we get a new variant or subvariant of concern, because it's shown very quickly to be more infectious, you've got to then figure out what's the relationship between that and the evasion of vaccine protection and, of course, corollary to that is, what does it do in terms of the relationship to getting infected and ending up with severe illness or disease? So there's no silver, there's no, for me, there's no crystal ball answer. There's no way to answer that, except to say that we need to be prepared. We need to be prepared for the possibility that we actually plateau and maybe start coming down again, since we're headed into our warmer weather. And there may be opportunities that people are now taking to get themselves vaccinated and get up to date on their boosters. That adds these layers of protection. And again, hard to predict exactly where that will be. But we also, need to be fully prepared for a scenario where we start seeing those increases in hospitalizations and a corollary and devastating increase in deaths, in which case, if there's threats to the healthcare system, or we start seeing what we think is the start of that explosion in cases that will, no matter what, lead to more hospitalizations and more deaths than we ought to tolerate, we'll have to move with all of the tools we have, including the non-pharmaceutical interventions and including the pharmaceutical.
Hi, Dr. Furr, you've been muted. You want to unmute yourself and then repeat the last 30 seconds.
Oh yeah, sorry. Not sure how that happened.
Not sure either.
Yeah, I was saying that, because we know what preparedness looks like at this point, I think it's pretty easy for us to make sure we are prepared. We cannot lose our ability to have easy access to vaccines, therapeutics, and testing. So we are going to need to continue to fund those networks so that they can actually respond regardless of the increased demand. Because that's where we get hurt every single time, is when we don't have capacity to take the very basic protections that we'll need to make sure we're able to use during any significant increases in cases. And then, of course, working closely with the healthcare system so that they're able, now that we're out of the surge, to address some of the staffing issues that cropped up and some of the equipment issues. So again, I'm thankful we have great federal partners that really can help us make sure we got those supply chains secured, but we need to make sure that all of that happens as well. And then, I think the reinfection issue, it's concerning. It's most concerning with BA.4 and BA.5. We haven't seen to date a lot of evidence that those people infected with BA.2.12.1 are necessarily, that group is necessarily made up of a lot of sort of reinfections for people who got infected with BA.1 or BA.1.1. But that doesn't mean we're not going to, as we have more of that subvariant circulating, we're not going to find that there's some erosion there of that natural immunity that we're also hopeful people got who were recently infected. But certainly South Africa is worried about BA.4 and BA.5 because of what the mutations look like. They feel like there's much more likelihood that the protections people got from getting infected with an earlier variant of Omicron is not going to protect them from the new subtypes, the new subvariants. So we're going to have to follow that, because that would be very concerning. We probably had 2 million people infected with Omicron or some combination of Delta and Omicron towards the end of December and through January. And it would be, I think, very hard on all of them as well to recognize that they'd be at significant risks for a subtype of Omicron in any of the weeks to come. So we have to pay a lot of attention to the science. And I do hear you about the concern about the relapse issue with folks who have taken Paxlovid. I want to note that lots of scientists are looking at that data, trying to make sense of it, trying to issue guidance to practitioners, clinicians, and public health folks about the best way to think about those relapses. But they're real. They've happened in a significant enough number that they've been noticed by lots of folks in lots of different places. And we'll need to get some really good guidance on what that means for folks who have in fact relapsed. I know the California Department of Public Health is looking at this and is hoping that they'll be able to work with CDC and issue some guidance for clinicians on how to best manage patients who have had those relapses. And then I heard you on the question at the airports. I do want to say that our inspectors have been out giving advice and technical assistance at all the transportation hubs. I want to commend LAWA in particular for the fact that there is a lot of education that's very visible there. There's a lot of signage up, there are a lot of boards up. And when our inspector was out, the vast majority of employees, in fact, had their masks on. I think it's harder for the disembarking passengers to understand the rules in LA County. I have a lot of confidence that as the messaging continues, people will get more comfortable with the fact that they need to put their masks on once they get into the terminal areas. But thanks for that. And, we'll go on to the next question.
Our next question comes from Joy Benedict from CBS. Joy, you can unmute yourself.
Hi. Oh, I think
Hi.
That's working. Yes. Hi. Thanks for taking my question.
It's working good.
All right, good. A couple of things. I want to circle back to what you mentioned in the schools first, talking about transmission increasing, specifically with extracurricular activities. Is it time to curtail some things, or do you have a plan of action, or are you just pointing it out? And then also, I wanted to ask, some of your counterparts are calling this a sixth wave. I know you specifically said it's not a surge, but could we call it a wave? Is this something we need to be concerned about? And then just finally, an observation note. I see you wearing a mask today. You don't usually do those. Are you okay? Or you just got a lot of people in the room?
A lot of people. Yeah, no, thanks for the question on the mask. Yeah, unfortunately, because we went to a different platform, I've got the tech folks in with me just to make sure that this is all going to continue to work. But yeah, I'm fine, and I'm only wearing it. We wear our masks indoors in our offices, so when we're around other people. In terms of as you noted, we're seeing an increase in cases. I mean, I think whenever you see this big an increase in cases, it's up by 200%. Like, everyone should take notice. Like, that just means we have to be more careful. That means when you go into a room with 100 people, it's very likely that in that room, there'll be people, at least one or two people that are infected. So yeah, and I don't think, I think we all should continue to avoid getting infected for some of the reasons that folks just mentioned, earlier. I mean, we don't know enough about long COVID. We don't know, what long-term disability means for some people with long COVID. We don't know yet, with new variants circulating, what the relationship between getting infected and going on and, experiencing more severe illness is going to be. So yeah, I think you see this rise in cases, like, yeah, please be careful. Please be cautious. Please put those masks on. It's a simple thing you can do. It protects you and it protects other people, and it's not all that disruptive. And this is not going to be forever. But when you have this much transmission, let's be sensible and try to do our very best to avoid getting infected and avoid infecting others. I just think that's common sense right now. In terms of, what's going on at the schools, no, I'm not an advocate for curtailing activities, because I think you can do these activities with a lot of safety. But again, people have to recognize that, you're doing these proms, move them outdoors. I mean, one thing you could do that would immediately make a safer prom is to have it outside. So consider having them outside. Consider asking people to test before they come. And, certainly at schools, we have like ample supplies of testing. Like, nobody at a school would be short a testing kit that would allow them to ask the folks coming to these extracurricular activities, if they're going to be indoors and there's going to be a lot of close contacts, to get that test before gathering. And, for indoor activities that we always have recommended and continue to keep a mask on. So I don't think you need to eliminate any of these. I think people need to be cautious and careful. And have a good time, knowing that you don't want to wreck that good time by becoming sick or getting somebody else sick later on. So yes, I think we can do a good job. I want everyone to absolutely enjoy those extracurricular activities, but we still have to do them with some safety precautions in mind. So yeah, we could probably take one more question. I unfortunately have a hard stop today.
Sorry, would you clarify this as a sixth wave, though?
Oh yeah, sorry about that. I didn't. I don't think we have enough data points to think of it as a sixth wave. I mean, you can all see that curve. I showed it to you, but it's exaggerated. I looked at it over 4 weeks. Let's continue to track. It's certainly an increase. So if you want to think of all of these increases that go on for a significant amount of time, and this is over 4 weeks now, as being waves, I'm comfortable with that. What I'm most hopeful for is that we don't see an acceleration in exponential growth, and that we start pretty soon, stabilizing and coming back down. That I think is what would be most helpful for us. All of our waves in the past, I also want to note, have been characterized not just by an increase in cases, but also by an increase in hospitalizations a couple of weeks, 2 to 3 weeks later, and then an increase, sadly, in deaths. So we haven't seen either of those, and we're way past the 3-week mark. So again, when I think about waves, the waves similar to the waves we've experienced in the past, we've had increases in all 3 of those metrics, and we only have an increase right now in our case numbers. So again, but I'm comfortable with whatever terminology you'd like to use to characterize the fact that we are seeing a sustained increase over time in the number of people that are infected.
Dr. Fair, we do not have anyone else in the question queue.
Okay, that works perfectly. So thanks a lot, everyone. We'll talk again next week, and appreciate all of the great information you're sharing with our community. So thanks so much.
And thank you to everyone who joined us today. As a reminder, if you'd like to stick around, we do have Spanish remarks next. It'll just be a few minutes as we get that set up. Any additional media questions can be directed to our media inbox at media@ph.lacounty.gov. Thanks. All right. Good afternoon, everyone. Thank you so much for sticking around for our Spanish remarks. Today, May 4th, we have Jackie presenting. Jackie, when you are ready.
Great, thank you so much. Buenas tardes y gracias por acompañarnos durante la sesión informativa de hoy. Comenzaremos con una actualización. Repasaremos las medidas actuales de nuestras señales de alerta temprana e indicadores de preparación y discutiremos algunas de las acciones que entornos de alto riesgo, negocios, escuelas y residentes pueden tomar para mitigar el riesgo de COVID en nuestro condado. First slide, please. Durante la última semana siguió aumentando el número de casos y hoy informamos 2,484 casos nuevos. El promedio de casos diarios nuevos que fueron informados durante los últimos 7 días ha aumentado a casi 2,200, cual representa un aumento del 25% en solo una semana. Esta semana, el promedio de 7 días de nuestra tasa de casos diarios también aumentó a 21 casos nuevos por cada 100,000 residentes, a comparación a los 17 casos nuevos por cada 100,000 residentes desde hace una semana. Nuestra tasa actual de casos semanales se mantiene elevada en 12 por cada 100,000 residentes, señalando que el condado de Los Ángeles está nuevamente viendo una tasa de transmisión alta. Mientras los casos han ido aumentando constantemente, sentimos alivio de que nuestra tasa de positividad de la prueba subió muy levemente y las hospitalizaciones y muertes relacionadas con COVID se mantienen relativamente estables, con un promedio de la tasa diaria de positividad de la prueba del 2,2% y 248 pacientes con COVID actualmente hospitalizados en el condado de Los Ángeles. Seguimos viendo números relativamente bajos de muertes, con un promedio de 5 muertes reportadas cada día durante la última semana. Pero debido a que las muertes son un indicador rezagado, es posible que veamos un aumento en las próximas semanas. Y expresamos nuestras profundas condolencias junto con deseos de fortaleza y paz a todos los que están de duelo por la pérdida de un ser querido debido a COVID. Next slide, please. Además de revisar nuestros datos de la semana pasada, puede ser útil ver algunos de nuestros indicadores sobre un periodo de tiempo más largo. En este gráfico puede ver las tendencias sobre las últimas 4 semanas de nuestro promedio de 7 días de casos diarios por fecha de informe, el promedio de 7 días de hospitalizaciones diarias por fecha de admisión y el promedio de 7 días de muertes diarias por fecha de informe. Nuestro promedio de 7 días de casos diarios, la línea verde, han estado aumentando constantemente desde fines de marzo y aumentando más rápidamente desde el 20 de abril, lo que resultó en un aumento de casi el 200% durante el último mes. El promedio de 7 días de ingresos al hospital, la línea anaranjada, se mantiene relativamente estable, lo que puede reflejar el retraso habitual entre los casos y las hospitalizaciones, así como los efectos protectores de las vacunas, las dosis de refuerzo y el medicamento. Es importante tener en cuenta que muchas otras comunidades están comenzando a ver aumentos en hospitalizaciones asociadas con las variantes altamente infecciosas BA.2 y BA.2.12.1, que circulan ampliamente en muchas regiones de los Estados Unidos, incluido el condado de Los Ángeles. Las muertes también son un indicador rezagado y, como puede ver, el promedio de 7 días de muertes informadas cada día, la línea azul, se ha mantenido estable durante la última semana. El promedio de 7 días de hoy es aproximadamente 1/3 del promedio de hace un mes. Next slide, please. Nuestro nivel comunitario general, una medida de la gravedad de la enfermedad y de qué tan abrumado está nuestro sistema de atención médica, permanece en un nivel comunitario bajo esta semana. El primer indicador de hospital que determina nuestro nivel comunitario es la tasa agregada de 7 días de nuevas admisiones al hospital por COVID. Nuestra tasa actual de 2.6 admisiones por cada 100,000 habitantes cumple con los criterios de los CDC para el nivel comunitario bajo. Después de una disminución inicial, esta tasa aumentó la semana pasada a 2.3 admisiones por cada 100,000 residentes y permanece estable esta semana. El segundo indicador de hospital es el promedio de 7 días de la proporción de camas de hospitalización que tienen personal y están ocupadas por pacientes con COVID-19. Este indicador se ha mantenido relativamente estable este mes y hoy es del 1.4%, que también se considera que indica un nivel comunitario bajo. Ambos indicadores reflejan que en este momento COVID no está presionando nuestro sistema de atención médica y recursos. Next slide, please. Nuestros indicadores a nivel comunitario y a través de sectores específicos pueden proveer alertas tempranas de que la transmisión y el riesgo pueden estar aumentando. Si un indicador señala un área de preocupación elevada, consideramos las oportunidades para implementar medidas protectoras y comunicar información a residentes y trabajadores acerca de los pasos sensibles que pueden tomar para protegerse a sí mismos y a los demás. Desde el 31 de marzo, nuestro indicador del porcentaje de muestras secuenciadas que fueron identificadas como una nueva variante o subvariante de preocupación ha sido de un nivel de preocupación alta. Esta semana, 96% de las muestras recientes en el condado de Los Ángeles fueron identificadas como BA.2, una subvariante de Omicron de preocupación o sus sublinajes, de cual hablaremos en más detalle dentro de poco. Dos indicadores adicionales también son causa de preocupación elevada. Primero, con 13 brotes nuevos en entornos de kinder de transición al 12 grado, informados en los últimos 7 días, nuestros brotes en las escuelas son una causa de preocupación a nivel medio. También vimos un aumento en grupos de casos en sitios de trabajo y con 108 informes de grupos de casos en los últimos 7 días, este indicador ahora es de un nivel de preocupación medio. Después, vamos a describir los pasos que recomendamos para limitar la transmisión en entornos escolares, sitios de trabajo, igual que en entornos de alto riesgo. Pero primero hablaremos con más detalle acerca de varias de las señales de alerta temprana. Next slide, please. A través de nuestra secuenciación rutinaria de muestras positivas, seguimos identificando variantes y linajes que podrían significativamente impactar la salud pública. Puede ver nuestros resultados actuales en este gráfico. De las muestras secuenciadas que fueron recolectadas durante la semana que terminó el 16 de abril, Omicron representó el 100% de las muestras secuenciadas. El linaje Omicron BA.2 y sus sublinajes representan el 96% de las muestras positivas que fueron secuenciadas. A nivel nacional, BA.2 y sus linajes descendientes siguen predominando. Para la semana que terminó el 30 de abril, los CDC estiman que BA.2 representó el 62% de las muestras secuenciadas en los Estados Unidos. Sin embargo, hay una circulación creciente del sublinaje BA.2.12.1, cual el CDC estima que puede ser 25% más transmisible que BA.2. Esa subvariante representa aproximadamente 37% de muestras positivas secuenciadas en los Estados Unidos, a comparación del 29% de la semana pasada. En el condado de Los Ángeles, para la semana que terminó el 16 de abril, vimos un pequeño aumento en BA.12.1, con el 8% de muestras positivas secuenciadas identificadas como este linaje en particular. La semana pasada, los CDC anunciaron que se está realizando una evaluación adicional para comprender el impacto de BA.2.12.1 en la efectividad de la vacuna y que en este momento creen que nuestras vacunas seguirán protegiendo contra una enfermedad grave a quienes se vacunan, especialmente si se ponen dosis de refuerzo. Aunque no son comunes en los Estados Unidos, también estamos vigilando otros 2 linajes emergentes de Omicron, BA.4 y BA.5. En el condado de Los Ángeles, hasta la fecha, solo una muestra positiva que fue secuenciada se identificó como BA.4 y ninguna se identificó como BA.5. Sin embargo, estos linajes pueden tener una ventaja de crecimiento sobre BA.2 y se cree que están contribuyendo a un aumento rápido en los casos de COVID en Sudáfrica. BA.4 y BA.5 también tienen una mutación que estaba presente en la variante Delta, que puede haber estado relacionada con el aumento de la gravedad de la enfermedad causada por Delta. Por lo tanto, mientras vigilamos de cerca la investigación sobre estas variantes y sublinajes, nuestros residentes y trabajadores deben tomar precauciones prudentes para evitar infectarse y transmitir el COVID a otros. Y aquellos que tienen un mayor riesgo de COVID grave también deben de preguntar a su médico sobre tratamientos si se enferman de COVID. Next slide, please. Como hemos mencionado previamente, aumentos en las concentraciones del virus SARS-CoV-2 en las aguas residuales nos alertan sobre la posibilidad de que la transmisión comunitaria en un área determinada esté aumentando. Mientras hemos estado vigilando la concentración de aguas residuales en 4 sistemas locales a través del condado, durante las próximas semanas solo podremos informarles acerca de 2 de estos sistemas. Primero son los distritos de saneamiento del condado de Los Ángeles, la planta conjunta para el control de la contaminación del agua, cuya vigilancia de aguas residuales cubre las partes sur y este del condado que no forman parte de la ciudad de Los Ángeles. Y 2, la Agencia Ambiental y de Saneamiento de la ciudad de Los Ángeles, cuya vigilancia de aguas residuales cubre la mayor parte de la ciudad de Los Ángeles. Datos no estarán disponibles durante las próximas semanas para el sistema cloacal de Lancaster, cual forma parte del Distrito de Saneamiento del Condado de Los Ángeles, ni para los distritos municipales de agua de Las Vírgenes, mientras estos sistemas locales se cambian a un contratista nuevo de pruebas de laboratorio. Este gráfico muestra los datos más recientes de los distritos de saneamiento del Condado de Los Ángeles, la planta conjunta para el control de la contaminación del agua. La línea blanca representa el promedio móvil de 10 días de la concentración de SARS-CoV-2 en las aguas residuales. La línea discontinua azul muestra el promedio de la concentración de SARS-CoV-2 en aguas residuales de los 14 días anteriores y la línea discontinua amarilla muestra el doble del promedio de la concentración de SARS-CoV-2 en aguas residuales de los 14 días anteriores, cuál es lo que indica el motivo de preocupación. Como puede ver aquí, durante el último periodo de informe de 7 días, el promedio de la concentración de SARS-CoV-2 en las aguas residuales se ha mantenido bastante nivelado y la última medición estuvo justo por debajo del promedio de los 14 días anteriores. Next slide, please. Este gráfico muestra los datos de la Agencia Ambiental y de Saneamiento de la ciudad de Los Ángeles. Aquí también no vemos ningún cambio significativo al promedio de la concentración de SARS-CoV-2 en aguas residuales desde el último periodo de informe de 7 días. Next slide. Con una mayor transmisión en la comunidad, también estamos viendo una mayor transmisión en los sitios de trabajo. Dado que la cantidad de informes de grupos de casos en sitios de trabajo superó los 100 la semana pasada, el indicador de transmisión en sitios de trabajo se elevó a nivel de preocupación media. Entre el 25 de abril y el 2 de mayo se informaron 108 grupos de casos, 45% de los cuales fueron en los sectores de manufactura y comercio minorista. Las empresas representadas con mayor frecuencia en estos sectores incluyen tiendas de electrodomésticos y productos electrónicos, fabricación de equipos de transporte y distribuidores de materiales de construcción y equipos de suministros de jardinería. Con el aumento de casos en los sitios de trabajo, se recomienda el uso de estrategias de prevención adicionales para todos sitios de trabajo, independientemente de si actualmente hay casos en su sitio. Salud Pública agradece a los muchos trabajadores y empleadores que están tomando medidas de protección y estamos trabajando en estrecha colaboración con los representantes de los concilios de salud pública para ayudar a brindar mayor alcance, educación y asistencia técnica a los trabajadores en industrias de mayor riesgo. Next slide, please. También estamos viendo más brotes en las escuelas de kinder de transición al 12 grado, con más del doble de investigaciones abiertas entre el 27 de abril y el 3 de mayo que la semana anterior. Con 13 nuevos brotes en las aulas, 10 de los cuales fueron en escuelas primarias y 3 en escuelas intermedias. Este es un motivo de preocupación a nivel media. Como discutiremos hoy, Salud Pública está trabajando en estrecha colaboración con las escuelas para apoyar medidas que puedan reducir la propagación en entornos escolares. Este conteo de brotes no incluye los brotes relacionados con la escuela que ocurren fuera del salón de clases, como los que están asociados con deportes juveniles y actividades extracurriculares que incluyen teatro, banda, coro o clubes de servicio, donde también ha habido un reciente aumento en el número de brotes. Muchos de los brotes fuera de las aulas, algunos de los cuales han involucrado a decenas de estudiantes, se han relacionado con actividades como eventos escolares en interiores, bailes de graduación, actuaciones musicales y teatrales y excursiones. Se alienta a las escuelas a adoptar medidas para reducir la posibilidad de propagación en eventos afiliados a la escuela, incluido el uso de mascarillas en interiores, pruebas antes y después del evento y detección de síntomas y mejorar la ventilación en el transporte. Next slide, please. Además de los brotes, también vigilamos la cantidad de pruebas, la positividad de las pruebas y la cantidad de casos en las escuelas. Este gráfico muestra la cantidad de pruebas escolares, las barras azules, y la positividad de las de las pruebas, la línea de tendencia morada, a lo largo del tiempo. Como puede ver, la cantidad de pruebas sigue siendo alta, con casi 460,000 pruebas realizadas entre el 25 y el 29 de abril. También puede ver que si bien las tasas de positividad de las pruebas han sido bajas desde el fin de la oleada invernal, han sido un poco más altas en los últimos 3 periodos de informes, con una tasa actual de alrededor del 0.4%. Next slide, please. Al igual que en periodos anteriores durante la pandemia, el aumento de la transmisión comunitaria a menudo contribuye a un aumento en casos entre el personal y los estudiantes de las escuelas primarias, intermedias y secundarias. La cantidad de casos informados entre estudiantes de deportes juveniles, escuelas primarias, secundarias y preparatorias durante un periodo de 7 días se más que cuadruplicó entre el 27 de marzo y el 24 de abril. Como recordatorio, los requisitos del uso de mascarillas en los interiores de las escuelas se relajaron el 12 de marzo, un par de semanas antes de que los casos comenzaron a aumentar. Como puede ver, ahora hay casi tantos casos entre los estudiantes y el personal como a mediados de febrero. Como ya han regresado los estudiantes y el personal a la escuela después de reunirse y viajar durante las vacaciones de primavera y con los eventos de fin de año escolar que se llevan a cabo ahora, podemos seguir viendo aumentos adicionales. En unos momentos compartiremos algunas de las medidas preventivas que estamos alentando a nuestros socios escolares a implementar para proteger a los estudiantes y al personal. Next slide, please. En los siguientes gráficos veremos los resultados más recientes de nuestras 13 medidas de preparación que nos ayudan a evaluar nuestra preparación para responder a un aumento repentino u otro desafío. Esta semana, todas las medidas sugieren una vez más una preparación satisfactoria, además del indicador que rastrea el porcentaje semanal de muestras de casos positivos que son secuenciados. Cabe destacar que el porcentaje de residentes elegibles que están confinados en su hogar y que fueron referidos a salud pública y que recibieron su vacuna dentro de las 2 semanas después de pedir la vacuna aumentó esta semana del 81% al 87%. Nos complace especialmente ver que este indicador mejoró desde la semana pasada, ya que asignamos personal adicional para respaldar este esfuerzo en respuesta a una caída en el rendimiento la semana anterior. Next slide, please. Como mencionamos, no alcanzamos nuestro objetivo de secuenciar el 5% o más de muestras de casos positivos por semana. Para el periodo de medición actual del 10 al 16 de abril, se secuenció el 3% de las muestras positivas, lo que no nos brinda muestras adecuadas para rastrear las variantes circulantes, identificar nuevas variantes o sublinajes o comprender las características claves de las variantes emergentes. Como se señaló la semana pasada, la secuenciación disminuyó significativamente cuando el laboratorio que realizaba la mayoría de las secuenciaciones en el condado de Los Ángeles perdió los fondos federales que habían apoyado este trabajo. Nos estamos comunicando con otros laboratorios para solicitar que proporcionen a salud pública sus muestras de secuenciación o sus resultados de secuenciación para analizarlos y estamos trabajando para establecer un contrato con un laboratorio para realizar secuenciación adicional. Puede tomar 1 o 2 semanas para que nos envíen estos informes adicionales. Next slide, please. Desde el inicio de la pandemia, hemos estado trabajando con entornos de alto riesgo, incluidos centros de atención médica, entornos de atención a largo plazo, como centros de enfermería especializada, albergues, centros correccionales y de detención, y centros de transporte públicos para mitigar el impacto de COVID. Nuestros equipos multidisciplinarios brindan a estos sitios información, educación y consultas sobre prácticas de control de infecciones y los ayudan a implementar estrategias preventivas en estos sitios. Se requiere el uso de mascarillas en los interiores en todos estos entornos de alto riesgo y continuamos ayudando a garantizar un suministro adecuado de mascarillas o respiradores que se ajusten bien según lo que exijan las normas locales o estatales para el personal, los visitantes, los pacientes y los residentes en los entornos de atención médica, entornos de atención a largo plazo, centros de atención para personas mayores y albergues. Y dado que los CDC continúan pidiendo que todos a partir de los 2 años de edad, independientemente de su estado de vacunación contra COVID, usen una mascarilla en los interiores de transporte público. Estamos agradecidos como socios de transporte del condado por educar al público y a sus empleados sobre esta medida de seguridad requerida. El cumplimiento cuidadoso de las reglas de aislamiento y cuarentena en entornos de alto riesgo también reduce la posibilidad de que COVID se propague a los trabajadores, clientes, pacientes y residentes que pueden ser más vulnerables. Nuestros equipos brindan información y consultas de manera rutinaria para ayudar a que los sitios de alto riesgo apliquen las reglas, incluidos los requisitos y excepciones específicos del sitio. Las prácticas efectivas de control de infecciones y manejo de brotes también son clave para prevenir la propagación, junto con una ventilación óptima que pueda reducir el riesgo de transmisión de COVID. Además de estas recomendaciones universales, alentamos a los entornos de atención médica y de entornos congregados a mejorar el acceso y el uso de las vacunas, dosis de refuerzo y medicamento, y a seguir la guía estatal y de salud pública para evaluar de manera adecuada al personal, los pacientes o los residentes que no están completamente vacunados o que han tenido una exposición. Sabemos que implementar nuevos sistemas y protocolos puede ser un desafío y agradecemos el compromiso que han hecho los entornos de alto riesgo para proteger a sus trabajadores, pacientes, residentes y clientes. Next slide, please. Como mencionamos, la cantidad de brotes, la tasa de positividad de pruebas y los casos entre estudiantes y personal han aumentado recientemente en las escuelas de kinder de transición al 12 grado, lo que es motivo de gran preocupación, especialmente dadas las altas tasas de transmisión del virus en el condado. Estamos trabajando con las escuelas para implementar medidas preventivas que puedan ayudar a frenar la transmisión entre los estudiantes y el personal, ya sea que estén en el salón de clases o participando en actividades afiliadas a la escuela. Nuestro equipo de apoyo escolar especializado ofrece a los compañeros escolares información, recursos, ayuda con el manejo de brotes y asistencia técnica para respaldar estrategias que mejoran la seguridad en las escuelas y en los eventos que son patrocinados por las escuelas. Dado el aumento en la transmisión comunitaria y el mayor número de casos en las escuelas, Salud Pública continúa recomendando que todos los estudiantes y el personal usen mascarillas o respiradores que se ajusten bien cuando estén en interiores escolares y exigimos el uso de mascarillas en el interior escolar para cualquier empleado o estudiante que no tenga síntomas, pero que han sido expuestos a alguien con COVID. Este simple paso puede marcar una diferencia sustancial, ya que sabemos que usar una mascarilla o un respirador en los interiores de entornos públicos se ha asociado con probabilidades significativamente más bajas de dar positivo por COVID y que los requisitos de uso de mascarillas en las escuelas se han asociado con riesgos más bajos de sufrir brotes. También alentamos a las escuelas a incorporar las pruebas de respuesta a COVID en sus operaciones regulares. Las pruebas de respuesta incluyen garantizar el acceso a las pruebas para los estudiantes y el personal que han estado expuestos a una persona con COVID y que tienen síntomas de COVID. Además, recomendamos que si hay recursos disponibles, las escuelas ofrezcan pruebas semanales para aquellos que no están completamente vacunados, ya que estas personas tienen un riesgo elevado de enfermarse gravemente si se infectan y se beneficiarán de un diagnóstico temprano. Con fondos de los CDC, nos hemos asociado con la Oficina de Educación del Condado de Los Ángeles y Heluna Health para apoyar las pruebas de COVID en escuelas públicas, autónomas y privadas en todo el condado. Apoyamos los programas de pruebas de COVID en las escuelas y brindamos apoyo para las pruebas en el sitio escolar. Esto incluye la distribución de más de 8.1 millones de pruebas de COVID proporcionadas por Salud Pública, el Estado y los CDC a estudiantes y personal de escuelas en todo el condado. Se espera que los padres y los estudiantes sigan las órdenes del oficial de salud de aislamiento y cuarentena. Los estudiantes que deben aislarse no deben regresar a la escuela hasta que hayan cumplido con su aislamiento. Si cumplen con el criterio para salir temprano del aislamiento, deben usar una mascarilla de alta protección al estar cerca de los demás, excepto cuando comen o beben, durante 10 días después de que comenzaron los síntomas o la fecha de su primera prueba positiva si son asintomáticos. Los estudiantes que fueron expuestos y son asintomáticos pueden permanecer en la escuela siempre que usen una máscara en el interior de la escuela cuando están cerca de otros durante 10 días después de su última exposición y se les hace una prueba de 3 a 5 días después de la exposición para asegurarse de que no estén infectados. Al igual que en el interior de otros lugares de trabajo, dada la capacidad del SARS-CoV-2 de ser aerosolizado, se alienta a las escuelas a considerar formas en que puedan mejorar la ventilación, que podría variar desde mantener puertas y ventanas abiertas hasta instalar purificadores de aire de alta eficiencia para garantizar que el sistema de aire acondicionado esté en buenas condiciones de funcionamiento. También sabemos que tener una comunidad altamente vacunada reduce los riesgos de transmisión y hospitalización y seguimos comprometidos a brindar fácil acceso a las vacunas para los estudiantes, así como información confiable sobre las vacunas para el personal escolar, los estudiantes y los padres. Hay cerca de 700 clínicas de vacunación en las escuelas programadas para mayo que ofrecen dosis para niños de 5 a 11 años, así como vacunas y dosis de refuerzo para personas elegibles de 12 años de edad y mayores. Hasta la fecha, se han realizado casi 9,300 clínicas de vacunación en escuelas a través del condado. Gracias a un compañerismo fuerte con muchos distritos escolares y grupos de padres, hay mayores oportunidades para que los padres y los estudiantes se inscriban en los programas de embajadores de padres y estudiantes. Hasta la fecha, más de 1,700 padres y casi 550 estudiantes han completado el programa de capacitación y pueden educar e informar a otros en sus escuelas y comunidades sobre las estrategias de prevención de COVID. Next slide, please. Con el aumento en brotes en los sitios de trabajo, también alentamos a los empleadores a implementar medidas de seguridad para proteger a sus trabajadores y clientes. Muchas de estas medidas son las mismas prácticas que se utilizan en entornos de alto riesgo y escuelas, incluidas la promoción del uso de mascarillas en interiores, el requisito de que los trabajadores sintomáticos se aíslen y se realicen la prueba, el requisito de que los trabajadores que han sido expuestos a COVID se realicen la prueba lo más antes posible y usen una mascarilla que se ajuste bien al estar en el interior del sitio alrededor de los demás, y el recomendar que los lugares de trabajo mejoren la ventilación. Con el aumento en transmisión, se recuerda a los empleadores que deben ofrecer mascarillas y respiradores que se ajusten bien a los trabajadores que trabajen en interiores en contacto cercano con otros. Si bien no se requiere de manera rutinaria, se recomienda el distanciamiento físico en áreas comunes como áreas de descanso y cafeterías en los lugares de trabajo. Además, todos los empleadores deben informar 3 o más casos de COVID dentro de un periodo de 14 días a Salud Pública para que podamos investigar y brindar orientación y asistencia en el sitio de trabajo según sea necesario. A medida que aumentan los grupos de casos, continuaremos promoviendo estas medidas de seguridad en todos los lugares de trabajo y dando prioridad a los sectores con mayor riesgo, como la fabricación y el almacenamiento. Next slide, please. Muchas personas están cansadas de la pandemia, están cansadas de usar mascarillas y están exhaustas tratando de lidiar con la incertidumbre del cambio constante. Es muy tentador minimizar el impacto del virus para apoyar nuestro deseo de volver a la vida que teníamos antes de la pandemia. Desafortunadamente, eso sería un error que podría ser más difícil tomar medidas que amplíen las protecciones y minimicen las interrupciones. Sigue habiendo pasos sensatos que podemos tomar para reducir el riesgo y prevenir enfermedades graves y muertes entre los más vulnerables. Para protegerse a sí mismo y a los demás, use una mascarilla o un respirador de alta protección que le quede bien cuando esté en contacto cercano con otras personas en los interiores de cualquier lugar. Vacúnese y si ya está completamente vacunado, obtenga una dosis de refuerzo o una segunda dosis de refuerzo si es elegible. Si se enferma, quédese en casa, lejos del trabajo, la escuela y los lugares públicos. Hágase la prueba en un sitio de prueba, en el consultorio de su médico, en una farmacia o en su casa. Y si da positivo, notifique a sus contactos cercanos y siga las reglas de aislamiento de salud pública. Si tiene síntomas leves o moderados y corre un alto riesgo de enfermarse gravemente, consulte a su proveedor sobre medicamento contra el COVID. Dada la importancia de iniciar estos medicamentos a los pocos días del inicio de los síntomas, Salud Pública también ofrece una opción de telesalud. Los residentes pueden llamar al 833-540-0473 los 7 días de la semana de 8 en la mañana a 8:30 en la noche para que les evalúen si son elegibles por teléfono para ver si pueden recibir los medicamentos antivirales. Y si son elegibles, el medicamento se le puede enviar por correo durante la noche a su hogar o a una farmacia cercana. Y este servicio es totalmente gratuito. Con el aumento de la transmisión comunitaria, es posible que esté expuesto a COVID-19. Y si es así, siga nuestras reglas de cuarentena. Y si no tiene síntomas y cumple con los requisitos para no quedarse en casa durante el periodo de cuarentena, hágase la prueba, vigile sus síntomas y siempre use una mascarilla altamente protectora cuando esté cerca de otras personas, especialmente en interiores durante los 10 días después de su exposición. Y finalmente, si tiene un alto riesgo de COVID o vive con alguien en alto riesgo, sea estratégico al reunirse con otros. Asegúrese de que usted y otros invitados estén vacunados y hayan recibido su dosis de refuerzo. Reúnase afuera si es posible o mantenga su reunión pequeña y mejore el flujo de aire interior con ventanas y puertas abiertas y ventiladores encendidos. Y hágase la prueba antes y después de la reunión como pudo haber estado expuesto. Para terminar, a medida que continuamos en esta fase después del aumento de la pandemia, seguimos enfocados en prevenir enfermedades graves y muertes, reconociendo que las altas tasas de transmisión aumentan el riesgo de enfermedades graves para los más vulnerables y pueden conducir a nuevas variantes que evaden la protección de la vacuna. los negocios, las escuelas, los centros de salud y otras organizaciones siguen desempeñando un papel clave en la promoción de la seguridad. Sin embargo, como hemos aprendido por experiencia, tenemos una mejor oportunidad de prevenir resultados trágicos cuando disminuimos la propagación, y eso sucederá más fácilmente si tenemos cuidado de evitar infectarnos e infectar a otros. Gracias a todos los negocios, organizaciones e individuos que están haciendo su parte para ayudarnos a protegernos unos a otros. Gracias.
Thank you so much, Jackie. And thank you to everyone who joined us today. Once again, we appreciate your patience with the technology. Any additional media questions can be directed to our media inbox at media@ph.lacounty.gov. Thank you again.